Good afternoon. Thanks for joining me here today. COVID's impacted all of us, and some more than others, so my sincere condolences to all Manitobans who've lost a loved one to COVID-19. And my thoughts go out also to those who are currently battling this virus. COVID-19's handed us new challenges, even greater challenges than before, but Manitobans are up for the challenge. This virus has challenged each of us to become more resilient, more innovative, and more determined than we ever thought necessary, and probably at this time of year more cognizant of the things we're doing without right now that we perhaps too much took for granted in the past. Our government's #1 priority in the face of this pandemic has been and will continue to be protecting our most vulnerable Manitobans and ensuring that our healthcare system is there for you when you need it. Notre priorité numéro 1 dans cette pandémie est de protéger nos Manitobains les plus vulnérables et de veiller à ce que notre système de santé soit là pour tous les Manitobains quand ils ont besoin. As we round out 2020 and look ahead to a new year, there is hope in the window for a safer and a healthier future. And today I want to talk to you about an exciting and truly monumental moment in Manitoba history. Tomorrow, 9 months after our first positive COVID case here in Manitoba, we will begin to deliver the first doses of the COVID-19 vaccine. Yesterday, I had the opportunity to tour Manitoba's first COVID-19 immunization clinic. It's been set up to begin administering the first 900 doses of this life-saving vaccine to protect our first group of healthcare providers, which will be starting tomorrow morning. This is a long-awaited day of hope for Manitobans, so I want to express first off my gratitude, and I know for many Manitobans a little bit of envy for those folks that are going to be able to get their vaccine. We say thank you and congratulations to you. We know that our frontline workers have been stepping up throughout this pandemic, and we know that stepping up now and protecting them is the right thing to do, so that we can protect them and their patients and the folks they look after as we roll out this immunization program carefully. I also wanted to say a word of thanks to our hardworking team and our partners in the healthcare system for the months of significant work that we've been doing to prepare for this and for many other aspects of the COVID pandemic challenge. We really didn't have a first wave in Manitoba, unlike most of the country. Our first wave and our second wave came at the same time, and it's hard to believe that it was late in October, just after Thanksgiving, that we first went to 3 figures plus in terms of our number of daily cases. It seems like years ago to most of us, but it was just a few weeks ago, and the challenges came fast and furious for everyone. And so I say to our frontline workers, to the team of planners and the many subgroups and subcommittees that have been working on dozens of aspects of COVID response, or literally thousands of moving parts, thank you so much for all your honest efforts. I know Manitobans thank you too. Our COVID-19 vaccine implementation task force has been working diligently to ensure our immunization rollout is as safe as possible and as effective as possible, so we can protect those Manitobans initially who are most at risk, and then work through our population and get that vaccine out to everyone who wants it. Following the safe arrival of the Pfizer vaccine, the immunization clinic will be launching tomorrow at the University of Manitoba's Rady Faculty of Medical Arts campus at the Health Sciences Centre here in Winnipeg. This site was chosen because it has the capacity to safely store the Pfizer vaccine. Pfizer vaccine has to be kept at ultra-low temperatures, and it cannot be moved after it's delivered. So nearly 900 appointments have been booked for Wednesday through Friday to immunize Manitoba's first priority group of specific at-risk healthcare workers I thanked earlier. Every immunization station, it's very impressive to see, has a laptop to support real-time data entry and to support the province's surveillance efforts as we follow up, including making the follow-up appointment right there for the second vaccine that has to be administered to protect everyone. 2 vaccines with the Pfizer vaccine, about 3 weeks apart. Each immunization appointment is scheduled to take about 45 minutes. That includes about a 15-minute recovery period where medical staff will monitor those who've received the vaccination, looking for any effects that may occur as a consequence. Each of the individuals immunized at the first clinic gets their second dose of the vaccine at our super site for vaccine storage, administration, and logistics, which I'm pleased to announce today as well, will be located at the RBC Convention Center in Winnipeg. As well, an ultra-low temperature freezer was installed at the Convention Center yesterday. It's expected to be fully operational in January as additional supplies of vaccine are delivered, as we hope they will be, obviously. This is the first step in our commitment to establish fixed vaccination sites to protect Manitobans throughout our province. In addition to the RBC Convention Center site here in Winnipeg, those sites will be located around the province in communities like Brandon, Thompson, Steinbach, Gimli, Portage, Prairie, and the Paw. Currently, the Pfizer vaccine arrives in 975 doses that must remain in the same location where they are to be delivered. We expect to receive other COVID-19 vaccines in the future that can be broken down into smaller amounts and be transported. And when that is possible, we'll create mobile vaccination teams, and they'll be able to use both ground and air transportation to reach more of our remote and northern communities, and more to say on that in a minute. To prepare for this historic immunization campaign, we've secured more than 60 specialized freezers to meet the storage and distribution demands of the COVID-19 vaccines. And by January, we'll have the capacity to safely store more than 1.8 million doses of vaccine. Now, while we recognize the hope that all Manitobans feel today, and I feel it too, I ask all Manitobans for their patience and their understanding at this crucial time as we gradually roll out our immunization program as more vaccines become available and arrive in Manitoba. More information about the next shipments of COVID-19 vaccine will be shared with you in the coming days as we are transparent in our efforts to get this information out to you. I remind you as well that there are many moving parts and that details will determine future courses of action. But we are hopeful that, and we know that we are ready to receive and administer life-saving vaccines to protect Manitobans, initially those who are most at risk of this deadly virus. This is a monumental challenge, an historic challenge, but it provides us with monumental opportunities, and I encourage all Manitobans who are willing and able to join Team Manitoba and help save lives to consider doing so. We're looking for qualified Manitobans with a wide range of skills and experiences to be part of our unprecedented COVID-19 vaccination rollout. A reference, we've done some courses in partnership with Red River as an example, and folks have stepped up, taken these courses, and are helping right now at our testing sites in many parts of the province. Just one example of the kinds of efforts that people are making to step up and help. If you'd like to help, if you're available to help, for more information, for a list of current positions, just visit manitoba.ca/COVID-19/vaccine/jobs. I want to just take a sidestep for a minute, if I could, and talk about the flu vaccine. There's been a lot of talk and excitement about the COVID vaccine, but the flu vaccine is really important too. And I want to take this opportunity to remind Manitobans of the importance of getting your flu shot this season. Given the additional challenges that COVID poses, we recognized this year that it was time to refresh our flu campaign and focus our message so we got more Manitobans interested in getting that flu shot this year, and especially those most at risk. We did a number of things, ad campaigns and so on, but the important thing is Manitobans responded. And I'm pleased to report that we've administered over 383,000 doses of the influenza vaccine to date this year. Now that is 27.5% of the population of the province, but I guess more importantly, it represents more than 2,200 more vaccines already this flu season than we administered the total of last year. So thank you to those who are stepping up. This is the most seasonal flu immunizations that's ever been delivered in the history of Manitoba, and I want to say thanks to Manitobans. please consider getting a flu shot and making sure you protect yourself at this critical time in our history. The threat of COVID-19 has also reinforced how important immunization is for all of us as a tool to prevent the spread of a serious disease. And I continue to encourage all eligible Manitobans to get their seasonal flu shot as an extra layer of protection this winter. Finally, another layer of protection against this deadly virus has sadly had to be our enforcement measures. We used education. Our Ready, Safe, Grow program throughout the entire summer was focused on, most of it, on trying to get people to do the right things that Dr. Roos and many others, our health minister, Cam Friesen, and myself have been repeating. But sadly, some people just didn't seem to get it. And so when you put yourself at risk, you're putting others at risk too, and you're going to face consequences for that. The good news is that our officials, our inspectors are telling us that our enforcement efforts are beginning to pay off. And I would note a drop in the number of tickets that were issued this week compared to last, pretty significant drop, despite an increase in the number of inspections that were done. That's a good indicator that Manitobans are getting the point. And I thank all of you who are abiding by these health orders. This past week, just for detail, 48 tickets were issued, total of over $80,000 in fines, 7 to businesses at the $5,000 level, 36 $1,296 tickets to individuals for various offenses, 5 $300 tickets for failing to wear a mask in indoor public places. Our enforcement officials advise that gatherings in private residences continue to be a concern, and with the cold weather here and the holidays approaching, I know that the temptation will be there for you to gather, but we must not. We must not, because our actions now determine how we are going to start the new year, and they determine who we're going to start it with too. And it's important to remember that others' lives are in your hands now, literally. I want to also say to Manitobans, you know, as bad as it is with the number of cases, the number of people in hospital, the number of people who've died from COVID, and it is bad. Understand that every jurisdiction around the world is facing these challenges, and understand that the restrictions that you're having to endure, the sacrifices you're making are working. While almost every other jurisdiction across Canada right now is seeing record high numbers of cases, hospitalizations, ICUs, double-digit increases week over week in their COVID cases. Manitoba's, along with BC, the only province that's actually starting to bend the COVID curve down. Outside of the Maritimes, every other province sees their numbers rising, some of them at record levels, 16, 17, 25% in Ontario, Quebec, and Alberta. Public health orders in place are working, but we aren't there yet. And with the cold weather approaching and the holiday season around the corner, I'm asking Manitobans to be extremely diligent, continue to follow the fundamentals. When we follow those fundamentals, we can beat COVID. When we forget about them, COVID beats us. This past month hasn't been easy, and I thank Manitobans for their patience, their understanding, their willingness to make these sacrifices. Because you're doing it for you, but you're doing it for your family, your friends, your neighborhood, and your healthcare system too. But I'm confident, as hard as these times are right now, and the sacrifices are real, that it's worth it. Because if we continue to work together, we can get back to beating COVID. This is a team effort. We all have a role to play, not just in protecting ourselves and our loved ones, but in protecting our community as well. We've done it before. We can do it again. We need everyone on Team Manitoba. Thanks. Look forward to your questions.
Thank you, Mr. Premier. A reminder to reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. Mr. Premier, when will you be receiving your COVID vaccine?
My turn with everybody else, anxious as a senior with asthma should be to get it, but we'll be waiting our turn. And I advise all Manitobans to do the same. Remember that the public health officials are having to make, along with the federal government, that they're working with closely. They're going to have to make some very difficult decisions about who is the most vulnerable and who should get the vaccine first. We would all want it, but please be patient. we'll wait our turn and we'll accept the recommendations of our public health officials in terms of the priorities on who should get the vaccines and in what order.
And now that we know the vaccines are coming, when is the province going to be addressing the secondary issues that have resulted from the pandemic? So things like its effects on mental health or its disproportionate effect on the homeless population.
Really important question. We have taken numerous steps to address both those categories and many others as well. I would talk also about our seniors population. Vulnerable seniors who live in their own residences, rent accommodation, are also needing supports and helps. Our volunteer network of support to help people with shopping, our work with the business groups to help them to make shopping times available through the Retail Council and others. For seniors and vulnerable people, our supports for the disabled, those living with a disability. We're going to continue those supports because our focus is on supporting our most vulnerable citizens, and that's critically important at this time.
From the Winnipeg Free Press, Danielle.
Good afternoon, Premier. I'm wondering, when it comes to communicating with the public about who gets the vaccine and when, is the province planning to release a comprehensive immunization schedule for the next 200,000 plus doses so that we know what to expect?
Sorry to cut you off, Danielle. It's a great question. And Dr. Roussin and I have spoken about this a couple of times. I think it's really important to let Manitobans know, be upfront and very transparent about what the priority is and how it's being determined. Because I know, and you know, that this is a real scary time for a lot of people, and they really would like to get the vaccine. We've seen significant research done. The approval process has been gone through for some, and there are more coming. So the vaccines are coming, but I think it's important that that transparency continue and be extended to Manitobans so they can see where they line up. And then, of course, we'll have to, all of us, be patient and wait our turn.
Okay, thank you. And I was just wondering, with our COVID-19 vaccine implementation task force, is there First Nations representation on that task force, and who is it?
Yeah, Dr. Roussin can tell you the names of everybody, but there's interaction going on not only here in Manitoba, but also with the federal First Nations Inuit Health Branch on a regular basis. This is in part how we were able to obtain more vaccines. As you know, I had raised this with the Prime Minister. The concerns I have and continue to have about vulnerable Indigenous population are very real, and through the work of a number of folks, and I've congratulated the work of our leaders, Indigenous community leaders several times, but I'll say it again today, in spite of the recent numbers, which are not exciting on First Nations, to put it mildly. The chiefs and their councils have been working very, very hard. So we were able to obtain close to 10,000 additional vaccines above the per capita allocations for Manitoba First Nations. And I think that those avenues of addressing our priority needs have been ones that we've pursued effectively as a team here in Manitoba, and we'll continue to do that.
From Global, Marnie.
Good afternoon, Mr. Premier. We asked this question of Dr. Roussin earlier today, but we also wanted to ask it of you. About 9 months or so into this pandemic, what is it like for you, seeing the vaccination facility, knowing that it's arriving today, going to be start doling it out tomorrow? What's kind of going through your mind, and what's that like for you, knowing that we are at this step in the fight against COVID?
I'm hoping that in a few months, I'm not going to let my guard down, and I'll urge Manitobans not to let their guard down. This is a few months away. This is a marathon. This is not a sprint. And I'm reserving my hope, qualifying my hope a little bit, Marnie, just to say that again. We're going to have 1 in 1,000 Manitobans that would like to have that vaccine get it over the next 3 days. 1 in 1,000. We can't let our guard down. But quite frankly, I'm really excited to start hugging people again. I kind of like that, and sometimes they like it too. So I'm looking forward to that, and I hope that we can do that. But in the meantime, we've got to be very careful about reducing our contacts, doing the things Dr. Roussin recommends we do, making sure that we're very, very diligent, because this isn't over yet.
Thank you for that. And that kind of leads into my next question. How concerned are you that, the arrival of the vaccine will kind of have people letting their guard down or becoming more complacent? And what's your messaging to people who might have that mindset?
Yeah, no, this is a topic of real concern. I've had numerous meetings on this. I know that health experts all over the country are concerned. I can say this without, I don't want to always be, I'm being called the Grinch is fine and funny, but after a while, you just don't want to give negative messages all the time. But I have to say this, it's not over. It isn't going to be over for a while, and we can make sure that it doesn't make a comeback if we do the right things. So let's stick to our fundamentals. We're starting, as I said earlier, our numbers week over week, and I'm not running a victory lap. I want to be really clear, but these are the StatsCan numbers. Our numbers week over week were down in Manitoba by 15.8%, and they were up by the same amount in Ontario. Now, Premier Ford's got lots of challenges there, and this is not about Manitoba's better than Ontario. This is just saying to Manitobans, we've got tougher restrictions. Those restrictions are working. They're saving lives. But we have to stay at it. We have to stay at it, and we have to persevere. And then we'll have a lot to celebrate next Christmas that we weren't able to celebrate perhaps this year in 2020.
From the Brandon Sun, Drew.
Thank you. Mr. Premier, when will vaccines start to go out beyond Winnipeg to the Prairie Mountain Health region, for example?
In the coming month, we anticipate vaccine availability will be able to be out to Brandon and to Parkland and to numerous other areas of the province. The Moderna vaccine that is coming doesn't require extensive cold storage. It doesn't have to be administered right where you get it. And so that Moderna vaccine still takes the 2 needles, but that Moderna can be shipped over to other communities. And so we're excited to see that happen early in the new year.
Okay, thank you. Just to follow up, at this point, I know it's still early, but do you believe that the federal government has done its due diligence in terms of the timing of getting the vaccine out to Canadians?
I choose not to comment on the work of the federal government in that respect at this point, except to say that we're pleased to see their cooperation in getting the vaccines that we have. I have advocated for more vaccines for Manitoba First Nations people, whether living on or off reserve, because we know those numbers are exploding. And I'll continue to advocate for that, regardless of criticism. Because it is critically important that we get these vaccines, and we need, because we have a high percentage of Indigenous people who are getting COVID, we need to know that we need those vaccines in our province. I can tell you that with approximate numbers that more than a third of our cases are Indigenous people, yet that's 14% of our population. And so the federal government needs to help us with this. They need to step up and help. And this is just, it's a frank admission that all of us are equally likely to get COVID, but some of us are more than equal in the sense of its likelihood. Because if we live in an environment where we're closer knit, isolated, perhaps in a northern community, there's a greater likelihood. And we were doing a great job all summer of not having COVID cases, but it's winter now and things change. And so I'm asking the federal government to step up. 50% plus of our ICU patients right now in Manitoba are Indigenous Manitobans. So we need the federal government to step up and help in that respect.
Okay, thank you.
From the Winnipeg Sun, Scott.
Good afternoon, Premier. First question: does this new? I know it's just the one facility so far for these first 900 tests, but I guess when it does expand, and even now, are there EpiPens and other resources on site to deal with potential? We've heard of allergic reactions and stuff like that, and people may not know even that they will have one. Will that sort of stuff be on site just in case? Will that stuff be there if people need it?
Yes, Scott, and numerous other preparations have been done. I think it'd be good to, I think early next week we're talking, or sometime next week we're talking about doing additional briefing where we're going to get more information out on how all the preparatory work that's gone into this in a little more detail. Right now, I would say, you know, over the next 3 days, we're going to have our first, there have been numerous dress rehearsals already. The preparation that the nurses and other staff told us about yesterday was really impressive. But we want to get through this and then share some additional preparatory information and committee work that's being done so Manitobans can have a greater awareness of not just what's been done to prepare, but a greater sense of confidence that when their turn comes or somebody in their family is eligible to get the vaccine, they're going to be well looked after.
Thanks for that. And shifting gears to the decision by Peguis First Nation to have, I think they call them relaxed lockdown days, where they're allowing visitations between extended family and students. They are saying, essentially because they live on sovereign land, they can do what they want. The messaging here has been, steady in terms of, stay home over the holidays. You've been very vocal about that yourself. What is the message that you would have to the leadership in Peguis First Nation?
First of all, don't make a massive mistake. Don't do this. I said the same thing when the Quebec Premier was talking about relaxing Christmas visitation rules, which he has since changed his mind on, and I'll say it to Chief Hudson too. This is well-meaning but mistaken. This will endanger people in his community, over half of whom live elsewhere, who will travel home and travel back, potentially taking COVID or bringing it back with them. When we travel, we expose ourselves to greater risks, and we expose those around us to greater risks. And this is a massive mistake, and I'm deeply disappointed that the federal minister, Minister Miller, would come out and say that's fine with him. It is not fine. It is wrong. It is totally wrong. We have provincial public health orders that must be followed by all of us. COVID does not discriminate. Neither should we. And we're not going to have two sets of rules around who gets to have Christmas and how it's celebrated this year, because we're all doing our part to protect one another. We're all in this together. And I know that Chief Hudson is a good man and a well-meaning person, but this is a massive mistake on his part, and it's a massive mistake on the part of the federal minister to stand down on an issue like this when provincial public health orders are laws of general application that apply to everyone in our province. They don't apply just off reserves. I've written the Prime Minister on this morning. I expect him to step up and make sure this correction is made, and made immediately.
From CBC Radio Canada, Mohammed.
Hello, Premier Pallister. I have a question about the Moderna vaccine. We've heard that the Moderna vaccine should come sooner in Canada. Could you tell us what does that mean for Manitoba, and when do you think that you will be able to vaccinate remote communities in northern Manitoba with this Moderna vaccine?
As soon as possible. I can't give you specific dates, and I wouldn't unless the vaccine was well on its way here, because I have enough experience to know that promises aren't the same as a needle in the arm, and I want the vaccine to be here and us to be assured of its presence before I start speculating further on its availability.
Thank you. And I would like to know, did the health worker in charge of the immunization program will get vaccinated before they give the vaccine or not?
Yes, they will, and of course they should. They're going to be coming in close contact with everyone who is going through those immunization stations, either now with the Rady Center location or later with the actual convention center and then the other remote locations. And so, yes, the health workers will be the first to be vaccinated.
From CBC Manitoba, Bart.
Hey, Mr. Premier, along the lines of the question Danielle asked, what is Manitoba's target for vaccination numbers for the end of January, end of February, end of March?
Yeah, well, Bartley, this is, as you would understand, this is a moving target. Just had a question a second ago about renewed rumor about additional vaccine, and so each day that passes, we're hopeful that we're getting the reality of those rumors here in Canada, and especially here, of course, in Manitoba, from my perspective. So I think Dr. Roussin can probably, I'll let him do the speculating. You know me well enough to know that I think a vaccine in the arm is better than two in the bush, if you know what I mean.
Appreciate that. Thank you. Off topic on this one. Earlier today, you made a comment to my colleague Marjorie Dowhouse, who stated you were asked why the province didn't enact tougher restrictions earlier, especially when you had data, and you said that Manitobans wouldn't have gone along for it. Why would you defer to the public's opinion rather than doing what's necessary the way Australia, New Zealand, Taiwan have done, all non-dictatorships that went really hard with restrictions?
I think there's a danger in believing your own rhetoric in your preamble there, Bart. I'll just say this. If we had brought in restrictions in the middle of the summer when we had 3 weeks of no cases to shut down businesses, the public would have ignored those restrictions and we'd have been lost. What I was referring to was the need to make sure that there's public engagement in the uptake on all these restrictions, because without it, they're not really going to work. They're not going to work effectively. And so what we've been endeavoring to do is, throughout this pandemic, make the case to the public as to why these restrictions we're asking people to live with, that restrict their basic freedoms, as you well know, of mobility, of freedom in some cases to associate with one another. These are really precious freedoms to people, and they won't be sacrificed lightly. My point is this, and perhaps wasn't sufficiently clear to your colleague, but that it is really important to engage the public at every step of the way when you introduce restrictions. And if you bring them in before the public understands they're necessary, then they won't be supported, and you will end up with worse results than you'd have if you hadn't brought them in at all. In my estimation, it's really important. We brought in restrictions that were more severe than most jurisdictions, but we definitely did it with consideration to the need to communicate the reasons to the public in full and in force. And we did that, and we'll continue to do that as we move forward. For example, with the vaccines, we take the leadership responsibility very seriously of encouraging Manitobans to take this vaccine when it's available, and we have to make that case. So we're already embarking on plans to do so, to make sure that the public is made aware of the reasons for these restrictions and for these decisions that we're taking with every passing pandemic challenge.
From the Canadian Press, Steve.
Good afternoon, Premier. Is there going to be an advertising campaign to encourage people to get the vaccine and to counter some of the misinformation that's out there in the wild west of social media?
Yeah, I don't like associating the West with dumb, so I'm not going to accept your preamble on that, but I understand the point. And we are definitely going to be undertaking multimedia campaign here to get people on side, because it really, the key here is this herd immunity concept, and we need big uptake. When these vaccines come in, it isn't good enough that only some of us are involved. We need to get as many people as possible on side. This is really important for public health, but it's also important for economic health and well-being as well. And so vitally important, and yes, the answer to, I guess the long answer to your question, Steve, is yes.
Okay, thanks. And I don't know if you've seen a new ad out of the province of Alberta, not specific to the vaccine, but speaking to the need to take precautions and social distancing and avoid gatherings. They've got an actor with a big COVID germ on his head at a dinner table and that sort of thing. It's very visual. It drives home the point. Is that something that Manitoba would consider?
I think that Chief Hudson up at Pegwish should watch that ad and then distribute it to everybody in the community as soon as possible.
From CTV Winnipeg, John.
Hello, Mr. Premier. It's John Hendricks from CTV. I'm just wondering, following the initial sign-up efforts for the first round of vaccination, what lessons has the province learned that you guys will then apply to future rounds?
Well, one lesson, I think, would be don't make the number public except to those people who you want to give the opportunity for a vaccine to. If you do that, you're going to get a bunch of scofflaw behavior, and you're going to get people who are really anxious wanting to call that number because they'd like to get in line for vaccines. So that was certainly something I think that was too bad. I understand it wasn't an intentional thing. I think the number went out and got out in the public, and there were, 170,000 calls. We only have 9,000 vaccines. That means a lot of people waited who shouldn't have had to wait, who were priority people that had been recognized that they should have got it. So I think one thing to learn is that. I'm sure the entire vaccine team is looking at every improvement they can make possible. And I'd say to Manitobans, understand, not going to be perfect. Nobody gets it perfect. Ted Williams, the best hitter in the history of Major League Baseball, and he went out 6 times out of 10. He went to the plate in his best season. So, nobody's going to get it right all the time. Our folks are working really hard to get it right on every aspect of this, but there'll be hiccups along the way, and expect that to happen.
Thank you for that. You mentioned that the number of fines has declined in the last period, but we're several weeks into restrictions now. I'm wondering why you think that there's still a sizable number of people who are having trouble following the rules.
I think we're human beings. I think we've got to suppress some natural human emotions and motivations here, and it's very hard to do. It's a time of year that's precious to many of us, where we want to get together, we want to show our love and experience our love for one another, and we can't do that. It's very hard. But I'm asking Manitobans again, understand, out of love for others and yourself and your family, make sure that you follow the rules. We need to follow the rules if we're going to get through this. And the more that we do that, the better chance we have of doing so.
From City News, Stephanie.
Hi, Mr. Premier. Stephanie Olsuk with City News. First, just wanted to get clarification about the 10,000 additional vaccines that you mentioned earlier. Were those just secured today? When will they be arriving? Just details about that.
Patty Hadju, actually, the federal health minister, confirmed on national television last night what I've been telling folks in Manitoba for a week now. Thanks to the focused efforts of our government and our partners, we were able to secure 9,600 is the exact number of additional vaccines over and above our per capita. This is for Indigenous high-risk people to get when Moderna is available, and we don't know the detail of the timing yet. But what we do know is that we're able to get some additional protections for our First Nations people. I won't speak on behalf of the chiefs. I did speak to several of the chiefs last week. But I will say I think generally there's very great happiness that that is the case, and I thank everybody for working hard to achieve that. But we're not there yet, and we're going to need more support because the numbers are continuing to grow. Our percentage of cases of Indigenous Manitobans on and off reserve. And again, I should mention, a significant majority of the folks who are Peguis First Nations residents don't reside on Peguis. So almost 2/3 reside in cities elsewhere like Winnipeg and Selkirk and so on. And so when I say I'm very, very concerned about protecting Indigenous people, I mean both on and off reserve. And that's why I'm so animated when I say I really discourage reducing the restrictions of the public health orders by community, whether it was this summer, as you remember, when Lake Manitoba First Nation suggested that they were going to go ahead with a powwow and involve invites to many other communities and First Nations and elsewhere. I said, no, that's not a good idea. Like that, this Peguis proposal is a very major mistake. And it's not just me. Melanie McKinnon, who you might know leads the pandemic response team established by the Assembly of Manitoba Chiefs, urges all First Nations against visiting outside immediate households, including over the holidays. That's Melanie McKinnon from the pandemic response team from the Assembly of Manitoba Chiefs. It isn't just me, the big non-Indigenous guy, complaining about this proposal. It's Indigenous folks who know that they don't have the health resources, they don't have the human resources locally in nursing stations and health centers to deal with this. Hospitals are full, ICUs are overrun, and we can't have people going out making up their own rules willy-nilly while the federal government stands back and says it's fine. Minister Miller should be ashamed of himself, quite frankly, for taking that position again. It's not being kind to First Nations people to say you respect rules that are endangering those First Nations people. It's being thoughtless, and we don't have two separate sets of rules here in Manitoba. We have public health rules that apply to every one of us, for the good of every one of us, in the name of protecting every one of us.
Okay, and then you kind of addressed it there, but I just wanted to ask, when was the last time, or how recently have you been in conversation with First Nations leaders with the ANC about vaccine rollout?
Last week.
From the Steinbach Carillon, Josh.
Mr. Premier, we've talked to small business owners who think the government is micromanaging store shelves, who say health inspectors don't agree on the rules and that the grants don't cover enough. How can you say your government is pro-small business, given, as they see it, these excessive regulations right before Christmas?
I can say it because it's a fact. I can say it because we have the most generous support programs in the country for small business, and I can say it with the full understanding that I'd hate it if I was in small business myself, so there's where I come from. We're doing the best we can with what we got. We inherited a mess. We're cleaning it up the best we can. We got from $1 billion deficit to a balanced budget, and now we got another mess with COVID, and we're going to clean it up too. Who better to clean it up than the handyman and the cleaning person that did it the first time?
What do you have to say to former small business owners that the government put out of business?
What I have to say is that it's a tough time to be in small business. It's a tough time to be anybody who's trying to fight COVID. It's a tough time to be a family member who's lost among the 500 who've died in Manitoba. It's a tough time to see your friends get sick. It's a tough time to not be able to travel. It's a tough time for everybody. It's not just small business people. And no, I am totally sympathetic to small business people. I come from that. But I'll tell you what, we're not going to reopen all the small businesses just because somebody's yelling about it. That isn't how I work. The fact of the matter is, we have restrictions that are tough. They're tough on small businesses because they help save lives. And when you're the only province besides BC that is starting to see some downturn in the number of cases, and you're starting to see some light, you don't give up. You persevere. So I'm a determined man, and I'll persevere. And I'm sorry that anyone is suffering as a result of COVID. Deeply sorry. But it isn't small business people alone that are suffering. It's a heck of a lot of other people too. And we're all in this together, so we're all going to do our part, and we'll get out of this together too.
Our final reporter this afternoon from CBC National News, Cameron.
Further on the Moderna that the Prime Minister announced this morning. So it's 168,000 doses pending approval, which we're understanding should come in the next couple of days. Are you expecting Manitoba's allotment to come out of those? Are you expecting those shots to be in the province before the end of December?
Again, Cameron, I'm not going to speculate on the timing. The Prime Minister enjoyed making the announcement, I'm sure. I'll enjoy seeing the vaccines in Manitoba.
I'm not asking you to speculate, sir. I'm asking you if you have any information. Has the federal government been in contact, or have you been given any firm information about what you may be able to expect, or whether you'll be able to expect having more vaccines sooner? We're just asking whether you have that information yet.
I have speculative information. My point, Cameron, is that I won't speculate because I don't see the vaccines here yet, and I have no confirmation, hard confirmation. I only have speculation at this point. Paul's not saying anything, so I'm just going to say thanks to everybody. I believe I'll see you before you celebrate Christmas or other holiday seasons, so I'll in case I miss you or people are on this call who aren't going to be on another one this year, I just wish you and your families all the very best. I think that this year will most certainly go down as one of the more memorable ones in our lives, and I think that very, very many Manitobans will look back with great pride. And I thank the members of the media for their work, and I wish them well as they do their best to look forward to the new year with hope in their hearts and safety for them and their families. All the best, all the very best. Thank you.